Ready, set, go! I'm excited to teach you guys some of the things I learned from Maverick Conference, but just so you know, I'm still a noob. Interscalene and supraclavicular block. You want to place the ultrasound probe mid-clavicle in the supraclavicular fossa and have it facing down into the chest. Your first goal is to find that subclavian artery, and usually to the lateral side of the artery, you will immediately find the brachial plexus bundle. You can block it here for a supraclavicular block. So the position that we did was lateral with the head of the bed up to 45 degrees. However, you can also have them supine as well. If you don't want to do the supraclavicular block, you can slowly scan up the neck, keeping the nerves in view until it is between the anterior and middle scalene muscles as well. This is an interscalene block. One common analogy you can use is to find the traffic light view when you see the brachial plexus in between the muscles. It should look like this. Axillary block. Place the ultrasound probe just distal to the axilla and look for the axillary artery. The position is normally supine with the arm flexed at the elbow and the hand near the head. I usually look for the musculocutaneous nerve first because it's a little bit of an outcast and sometimes can be hard to find. It's usually on the superior side of the artery. Once you find that, you can look around the axillary artery for the other nerves to block. Be careful to not squish down with the probe too hard because you will hide the big axillary vein that is usually next to the artery. I was taught rumpus, which sounds funny, but it's a great way to remember where the general locations of the nerves will be. Radial is posterior, ulnar is inferior, and median and musculocutaneous is superior to the axillary artery. Remember that everyone's anatomy is different, and sometimes the nerves do not match this description perfectly. Fascia iliaca block. You place the ultrasound probe in a vertical alignment over the anterior superior iliac spine, or ASIS. Then you slide off medially and slowly angle it diagonally towards the umbilicus, all while aiming the probe towards the ilium. Your goal is to view a bow tie shape formed by the sartorius and internal oblique muscles. You then inject under the fascia iliaca and allow it to spread. The paying block, or paracapsular nerve group. The patient is normally supine. You place the ultrasound probe along the same line drawn between the ASIS and superior pubic ramus. It's usually parallel to the inguinal ligament. You slowly scan caudad until you view the landmark of a hyperechoic Nike check sign. Once there, you inject underneath the psoas tendon. Always keep the femoral artery in view so you know where to avoid for intravascular injection. This block is normally done with the lateral femoral cutaneous block for additional coverage. Lateral femoral cutaneous block. The patient is normally supine and you place the ultrasound probe horizontally with the femoral artery in view. You slowly scan laterally until you see the end of the sartorius muscle. There will be a small, shallow triangle shape with two snake eyes peeking through the triangle. For a better view, I toggled the ultrasound probe back and forth to see the snake eyes better. This is where you will inject to block the nerve. Femoral nerve block. Place the ultrasound probe along the femoral crease to see the femoral artery and nerve. The patient is normally supine. There will be a triangle shape lateral to the artery. The femoral nerve will be found in this triangle. You can also see the fascia lata line forming the upper part of the triangle. You can consider doing 3 injections when using ultrasound in different areas of the triangle, being careful to avoid the artery and vein. Sometimes it's a little difficult to see, which is why I recommend toggling back and forth to find the best view. Adductor canal block. We normally position the patient supine with the knee abducted in a frog leg position. Place the ultrasound probe mid-thigh and identify the femur. Slide the ultrasound probe medially until you locate the femoral artery. Toggle the probe back and forth until you place the femoral artery at the bottom of the boat, aka the sartorius muscle. I had to move the ultrasound probe around a lot because I wanted to make sure the femoral artery was at the bottom of the boat, and I think I distorted the shape a bit by how I was pressing down on the patient, so just be careful when you do that. Once you locate that, though, the saphenous nerve will be located on the anterior side of the artery. Popliteal plexus block. It is common to do an adductor canal block prior to this one since the patient position is the same and it is additional coverage for the patient. You will find the femoral artery and slowly scan caudad or towards the feet as you follow the trail of the artery. Eventually, the goal is to find a hyperechoic structure above the artery in the shape of a hat as you near the knee. Inject local anesthetic at 11 o'clock to the artery and it will flow down towards where the plexus will be. I originally believed that the plexus was above the artery, but it is more of an injection point landmark. Popliteal sciatic nerve block. Place the ultrasound probe in the popliteal fossa and locate the popliteal artery. The position that we learned was lateral position with the leg to be blocked on top. However, you can also do this block supine or prone as well. Once you find the popliteal artery, scan cephalad or toward the head slowly as you toggle the ultrasound probe back and forth to find the two nerves that come together. The tibial nerve is above and medial to the popliteal artery, while the common peroneal or fibular branch is lateral to the femoral artery. You find the view that has the two nerves coming together to form the sciatic nerve and inject there to block both branches.